The McKenzie Method is about independence and is effective in more than 90% of cases. In the evaluation and treatment of neck, back, and joint pain, we ask a series of questions to narrow down the list of diagnostic possibilities. The patient then performs a series of repeated movement testing in order to further narrow down the possibilities. What we're looking for is a directional preference. The directional preference is a direction that the body moves in order to decrease the presenting symptoms. Based on this, we give the patient only one exercise for two reasons. Number one, it increases the likelihood that they'll do the exercise. Number two, it limits the variables. If we give somebody a dozen exercises to do and they get worse, we have no way of knowing what exercise did that. If we give only one exercise, the patient is either going to get better, in which case we'll know exactly why, or they're going to get worse, in which case we'll know exactly why. The only difference now is, instead of being confused, we've got some valuable information in order to adjust the exercise accordingly. The analogy I often give is going to the allergist. If one had a food allergy, you go to the allergist, they wouldn't put out a buffet with a dozen different foods on it and ask you to eat them. There would be no way to determine what one of those foods would be causing the allergy. Once the symptoms are abolished, we teach the patient how to recover their full function and then how to prevent recurrence through a series of simple exercises. This allows the patient to essentially treat their own back, neck, or joint problem and avoid being dependent on the healthcare system.